Hello everyone. Today we are discussing very important and my favorite topic, ECG, electrocardiogram. So this is very important because in most of the medical emergencies, when patient comes to you with the chest pain, sweating or breathlessness, the first thing you do is ECG. So this is the important for a clinical practice point of view. Introduction and ECG, that is electrocardiogram, is one of the simplest and fastest tests used to evaluate activity in the heart. So it shows or it evaluate the activity which is going into the heart. Here, electrodes, which are small plastic patches that stick to the skin, are placed at certain spots on the chest, arms, and legs. So, the spots which are sticked on the chest, they are called as chest leads, and the rest which are sticked on arms and legs, those are called as limb leads. Then the electrodes are connected to the ECG machine by lead wires. So, this is the simple introduction. It records the electrical signals in the heart. Test results can help diagnose heart attacks, irregular heartbeats, which is called as arrhythmia. So, mainly heart attack and arrhythmias. An ECG is done to check the heartbeat. It shows how fast or how slow the heart is beating. That means the heart rate or heartbeat is detected by the ECG. ECG test results can help your care team to diagnose irregular heartbeats, which are called as arrhythmias, then previous heart attack. If the patient is suffering from or if the patient had an heart attack in past, then it can be diagnosed with the ECG. The cause of chest pain, it can be evaluated with the help of ECG. It may show signs of blocked or narrowed heart arteries. That means coronary artery blockage. It can be shown by ECG. The ECG also may be done to learn how well a pacemaker and heart disease treatments are working. So, whether the patient is having pacemaker or not, that can also be evaluated with the help of ECG. You may need an ECG if you have chest pain, dizziness, lightheadedness, or confusion, pounding, skipping, or fluttering heartbeat. Then fast pulse, shortness of breath, weakness or fatigue, reduced ability to exercise. So these are certain situations where you may need an ECG. If you have a family history of heart disease, you may need an ECG to screen for heart disease even if you don't have symptoms. The American Heart Association, that is AHA, says ECG screening may be considered for those at low risk of heart disease in general, even if there are no symptoms. Most heart doctors consider an ECG as a basic tool to screen for heart disease, although its use needs to be individualized. So, most of the heart diseases without any symptoms, the ECG is a basic tool to screen the heart disease. If symptoms tend to come and go, a regular ECG may not find a change in the heartbeat. Your healthcare team may suggest wearing an ECG monitor at home. So, this is another technique, that is Holter monitoring. So, there are several types of portable ECGs. One is Holter monitor and another is event monitor. Now, Holter monitor. This small portable ECG device is one for a day or more to record the heart's activity. You wear it at home and during daily activities. Event monitor. This device is like a Holter monitor, but it records only at certain times for a few minutes at time. It's typically worn for about 30 days. You usually push a button when you feel symptoms. Some devices automatically record when an irregular heart rhythm occurs. So, two types of portable ECG machines. Now, we will see principles of ECG. The ECG is based on cardiac action potential and cardiac conduction. The SA node generates the cardiac action potential, which is relayed down the cardiac conduction pathway, resulting change in the membrane voltage, that is potential, across the membrane of cardiomyocytes. This change in cardiac action potential results in continuous running of cardiac cycle. So basically, ECG is mainly based on the cardiac action potential and conducting system of the heart. The cardiac impulse transmits through the heart, spreads around the surrounding tissue, and finally reaches the skin of our body. This electric impulse in the skin is received by the electric electrodes of ECG machine, and it is processed to produce an electrocardiogram. So these are the principles of ECG. Now result. Results, your healthcare professional might talk to you about the ECG results the same day as the test. Sometimes the results are shared with you at your next appointment. A healthcare professional looks for heart signal pattern in ECG results. Doing this gives information about the heart's health, such as heart rate. So, what all you are going to see in ECG is heart rate. The heart rate is the number of times the heart beats in a minute. You can measure your heart rate by checking your pulse. But an ECG may be helpful if your pulse is difficult to feel or too irregular to count accurately. ECG results can help diagnose an unusually fast heart rate called tachycardia, or unusually slow heart rate also, which is called as bradycardia. So very slow heart rate is bradycardia and very fast heart rate is tachycardia. So ECG results can help to diagnose these conditions. So first was heart rate, then heart rhythm. How rhythmatically the heart functions. So heart's rhythm is the time between each heartbeat. It is also the signal pattern between each beat. An ECG can show irregular heartbeats called arrhythmias. Examples include atrial fibrillation and atrial flutter. Heart attack. ECG can diagnose a current or previous heart attack. The patterns on the ECG results can help a healthcare professional learn which part of heart is damaged. So from the ECG, it can be evaluated that the which artery is stenosed or which artery is blocked. Blood and oxygen supply to the heart. ECG done while you are having a chest pain symptoms can help your care team learn whether reduced blood flow to the heart is the cause. Heart structural changes. ECG results can provide clues about an enlarged heart, that is cardiomegaly. Then congenital heart defect and congenital heart conditions. So mostly the valvular conditions like mitral stenosis, aortic stenosis, mitral regurgitation, aortic regurgitation. If results show a change in the heartbeat, you may need more testing. For example, you might have an ultrasound of the heart which is called as echocardiogram. So whenever there are changes in the ECG, then you might need to do the echocardiogram, that is ultrasound of the heart. Now we'll see few basic things about the ECG leads. So the standard ECG has 12 leads. 3 standard limb leads, 3 augmented limb leads, and 6 precordial leads, which are also called as chest leads. So limb leads are 1, 2, 3. Each of the leads are bipolar, that is, they require two sensors on the skin to make a lead. If one connects a line between two sensors, one has a vector. So there will be a positive end at one electrode and negative at other. So the positioning for leads 1, 2 and 3 were first given by Enthoven. So it is called as Enthoven's triangle. So here you can see the position of V1 to V6. So these are the precordial leads, or you can say the chest leads. So here the V1 is placed in the fourth intercostal space to the right of sternum. V2 is placed into the fourth intercostal space to the left of sternum. V3 lead directly between the V2 and V4. V4 is in the fifth intercostal space at mid-clavicular line. V5 at the level with V4 but at the left anterior axillary line. V6 the level with the V5 but it is at the left mid axillary line. So according to this position, the view of heart is C. So V1, V2, septum of the heart, V3, V4, anterior portion, V5, V6, lateral portion. So you can see this. So this is the mid clavicular line, this is anterior axillary line, and this is mid axillary line. So this is the position of leads. These are the precordial leads V1 to V6, which are also called as chest leads. So this is very important where you are going to place your electrode. Same thing but in other view. You can see V1, V2, V3, V4, V5, V6. V1, V2 septal, V3, V4 anterior, V5, V6 lateral. Now ECG paper, if you see this ECG paper, I have magnified a small square into a large square. If you see the horizontally, one small box is equal to 0.04 second. So this one small box is equal to 0.04 seconds. And this one large box is equal to zero point 0.2 seconds. If you see the vertically, one large box one vertically one large box is equal to zero point 0.5 millivolt. Zero point 0.5 millivolt. So remember, one small box 0.04 second, one large box 0.20 seconds. Clinical interpretation of the ECG. Accurate analysis of ECG require thoroughness and care. The patient's age, gender, and clinical status should always be taken into account. Many mistakes in ECG interpretation are errors of omission. Therefore, a systematic approach is essential. So, this is a picture of normal ECG. You can see the ECG waves. This is a P wave. This is QRS, that is QRS complex. So from S to 2, this is the ST segment, and this point is called as J point. This is very important, ST segment. So this point is called as J point. ST segment is important for the ischemic heart disease, and this is your U wave. So this is the QRS interval. This is the QRS interval, and this is QT interval. So this is the normal ECG. Again, the full picture: 1, 2, 3 limb leads, augmented leads, and V1, V2, V3, V4, V5, V6. These are precordial leads. So these are the points which are to be analyzed carefully in every ECG. So first thing is the calibration and technical features, including the lead placement, then rhythm, heart rate, PR interval, QRS interval, QT or corrected QT interval, mean QRS electrical axis, P wave, QRS voltage, precordial R wave progression, abnormal Q wave, ST segments, T wave, and U wave. So this is very important checklist, should be analyzed carefully in each SCG. Now, how to evaluate the rhythm? Evaluate the rhythm strip at the bottom of 12 lead for following. Is the rhythm regular or irregular? Is there is a P wave before every QRS complex? Are there any abnormal leads? So you have to check whether the rhythm is regular, whether the P wave is followed by QRS complex. You have to check. So that is how you should check for the rhythm. Now, heart rate. So how will you calculate the heart rate? So rule of 300 or 1500. 10-second rule. So what is rule of 300? Count the number of big boxes between the two QRS complexes. So two QRS complexes you have to check. So if you see a big square, then count the number of big boxes between the two QRS complexes, and